Good morning. My name is John Vigory, and I'm the founder and CEO of Glucorecs. Glucorecs helps people with diabetes. Diabetes has never been higher in the public's awareness, so forgive me if this is redundant. You may already know that there are 400 million people living with diabetes in the world today, and 30 million in the U.S. However, I'd be willing to bet that you are shocked to learn, as we did in the Los Angeles Times recently, that over half of adults in California are either already chronic or emergent in diabetes. Since we don't yet know what causes diabetes, and there is no cure for diabetes, therapies for diabetes target glycemic control. That means managing the concentration of glucose in the patient's blood. Therefore, all diabetes therapies require self-monitoring of blood glucose testing. And it's a greater than $12 billion annual global market dominated by 3 companies. You know the ones I mean, the test strip systems and the continuous systems. They are all invasive. They involve lancing the fingertip for a blood sample or an invasive sensor implanted beneath the skin. Meanwhile, adherence for these patients has been an issue for decades, and strong aversion to painful, invasive testing is leading to devastating and very expensive health complications and hospitalizations. Glucorecs' solution to this enormous need is called GluFit. GluFit is the iPod of diabetes. Glucorecs' non-invasive technology will invoke a digital transformation in glucose testing. GluFit is a lifestyle form factor that discreetly scans the distal end of the patient's finger and transmits data to a paired device for analysis and display. No blood sample is required. Let me repeat that. No blood sample is required. The GluFit sensing action is not felt at all by the patient. It does not pierce, penetrate, nor even touch the skin. And the underpinning Glucorecs non-invasive sensing technology is patented in the U.S. and validated in preclinical human trials. The GluFit business model is like cable TV or mobile or software as a service. It's a subscription model with MRR, monthly recurring revenue. Glucorecs is not selling devices. GluFit is a high-value health service which solves a chronic daily need and comes with all monitoring and maintenance of device accuracy and other patient support services. We intend that GluFit subscribers will be fitted and onboarded with and by hospital, pharmacy, and clinic partners. GluFit's path to market begins with a precise indication for adolescent patients, ages 12 to 17, for non-critical use. As such, we anticipate a Class 2 low-risk product designation from the FDA and access to a de novo 510(k) approval process. Glucorecs has the technology, the team, and the IP to take GluFit into production, investigation, and achieve FDA approval. With hundreds of millions of patients to reach worldwide, licensing is the way to get this technology into the global market quickly. We expect that in a few years, most of Glucorecs' revenue will be from licensing. Glucorecs is led by a senior team of global innovators with a strong product design and engineering leadership track record. Please listen very carefully. We are rooted in best practices for quality management, and we abide by all regulations which govern the design of medical devices seeking FDA approval. Glucorecs is raising a Series seed round with expert help from WilmerHale and Palo Alto. I'm based in Mountain View. In light of our persistent issue with obesity in this country and our children getting younger and younger in diagnosis, people who are otherwise perfectly fit and healthy get diagnosed with this chronic illness. And for everyone who needs to arrest their diabetes and bring it under control, isn't it time we take the sting out of glucose testing? Thank you.
Thank you. Thank you, Glucorecs. Thank you. Questions from round tables? Okay, any questions? Yes. Just turn.
Now it's on. Quick question. What are the next steps? Like, what do you expect to achieve during, say, next 12 months, maybe 18 months? When do you expect to get the FDA approval? Can you just give some context around
Sure.
that?
Okay, to be very precise, the very next step in the electrical engineering is called pre-dev board. So there are a number of dev boards that we bring into the shop to replicate the signal chain that's been successfully designed and tested in human patients. So there's an 18-month window of milestones that we work with a contract manufacturer so that we can produce the production version and put it in the patient's hands. That's the first step to collecting data for an FDA submission. And of course, before that, there's a pre-submission where we begin a dialogue with the FDA. And I'd like to point out that my co-captain in the cockpit has multiple wins at the FDA and full life cycle of pre-submission through product marketing approval and PMA approval. So, the DNA of this outfit is FDA all the way, and we don't cut corners. We follow every regulation, and we do everything the right way.
And John, great, clearly articulated value proposition here. Why that particular go-to-market? Why those kids?
So if you take a look at our decision to start with adolescent patients, you might call it, walking before running, or you might call it, the adolescent patients came up number one in the balanced scorecard of risk and achievability and marketability. There's a group of clinics in Texas called Diabetes America, 20 clinics in Austin, San Antonio, Houston, Dallas. So the CEO of Diabetes America retired on January 1st this year, and I met him at his golf club in February. So we're really engaging the downstream, and the downstream is telling us that this is a market that no one is doing anything for, and we know that a mother who has a diabetic child goes through a tremendous anxiety, and if I can solve that, I know that the rest of the world is going to beat a path to Glucorecs' door.
One very small, simple question. Does it work?
It works. I have a 30-year career in R&D. I afforded myself 5 months of investigation to go through the scientific method of all the in vitro trials that were done, and of course culminating in the human trials. And I get that question a lot. When we are in a counterparty with an investment prospect, in my wildest dreams, the prospect says, "Show me your data. Tell me about how the trial was designed. Show me the lab engineering prototype. Let's talk about the IP." There's 150 pages that have been posted at uspto.org for several years, and if you want to bleed your eyes out reading them, you can learn exactly how this works.
Just very simply, can you demonstrate it, and what's your error rate compared to more invasive technologies?
So if you go to Walgreens right now and you spend the most that you can on a test strip, you'll get 5% MARD. If you spend, down the value chain 25 cents instead of $1 on your test strip, you'll get about 17 MARD. If you're in the intensive care and they insert a sensor into your artery, you'll get 7% MARD. Our MARD is in the low teens. So I don't want to say 11, 12, 13 because the sample size is too small to determine, but that's where we are. And fundamentally, when you compare a non-invasive technique to an invasive technique, you know that you can do the invasive technique 10, 20 times at the same pain and cost and use typical error correction and oversampling to even drive the accuracy further. Obviously, there's a massive big data case behind this, and it will just get more accurate and more accurate the more people use it.
So is the ultimate business model you license this eventually and you sell, make money off, right? The data and the monitoring, the peace of mind, right? I'm trying to understand, like,
Yeah, clearly.
the market, right?
Yeah, clearly. You're taking on J&J, Abbott Lab, and
Right.
Roche. Not going to happen.
Right.
So what I want to do is scratch out a path to FDA approval, then immediately start licensing them, licensing to China. In India, there are 175 million patients between the two. A product that I designed for an American teenager is not going to go into India. It's not going to go into China. So we want to work with people there who can take this technology, put it into a downstream product that'll be effective there.
Thank you. Thank you. We have to get going. Any question? Glucorecs stay with us. So after session. Thank you.